People can learn to do extraordinary things without a leg or an arm. Nigeria's amputee football team has its eye on winning the World Cup this fall. With prosthetics, amputees can do things almost as well as, or even better than, whole-bodied people. But it's better to save a limb, if possible. Jeff Bope nearly lost his arm after an accident in a utility vehicle when the driver lost control. The vehicle flipped, Bope's arm snapped, and the muscle and skin were torn away.
The way they described it in the medical reports, it was a near-field amputation.
Bope was flown to the University of Missouri Healthcare's Trauma Center.
When we first met him in the emergency room, we were concerned we may not be able to save his arm.
Dr. Jay Bridgman, a limb reconstruction specialist, was called in.
We took a muscle from his back and we used that to lay over the areas that were exposed that had lost tissue. And then that required the skill of the microsurgeon to sew the blood vessels together and the nerves together. Straighten your fingers out.
After more than a dozen surgeries, Bridgman said Bope's hand is functional.
What's key for him that he will have that's better than a prosthesis is a hand that has sensation, so he can feel objects and use the hand.
Saving limbs requires a team of doctors with different specialties. At the Cleveland Clinic, the majority of patients who get limb-saving surgeries have diabetes.
About 1/3 of diabetics at some point will develop an ulcer on their feet. And so where I see this area of limb salvage progressing is that we'll become better and more skilled and have more technology in restoring blood flow for these patients.
There will always be patients whose limbs can't be saved.
What we focus on in that case is getting that patient a well-constructed amputation of some sort, getting them into a prosthetic, and then they're wildly surprised about how they're able to achieve a normal activity level in their life.
Carol Pearson, VOA News.